Hi, I'm Kilty from One to One Wellness Center, and I'm going to teach you today a really excellent functional movement that releases a lot of tone in the lower back, especially when we do those kinds of things where we're terrified to stand up because of some pain in our lower back, because of our protecting or guarding from that pain that we've had. This is a great way to move into that. And again, we're going to have lots of range of motion with Jolene here, but your range is what matters. So we only go where it does not hurt, is totally comfortable, totally slow, totally relaxed. But the instructions will be like this. We're going to do an anterior and posterior pelvic tilt of the lower back. We're going to add on to that with a flexion forward, but we're going to start with the anterior tilt with some nice gentle breathing. So as Jolene breathes in, she's going to anterior tilt. So the hip comes forward, the belly comes forward, the back arches a little bit. When she breathes out, she's going to let things fall back. Her bum's actually going to curl under a little bit. She does that beautifully because she's pain-free. Then she breathes in and goes the opposite. She extends. So you might have a quarter of that range. Fantastic. We will work into the range that will get you so that you're optimally moving again. Good. So she's now done that 2, 3, 5 times, whatever feels really good. Then we're going to start to add some flexion. So as she breathes out, she's going to do the same movement. Then she's going to let her shoulders come forward. Her head kind of drops. She might go forward all the way, but she may not at first. She goes naturally all the way down. When she does get there, we're going to give a little tug at the ankles up. It'll contract the lower back muscles just a little bit. You'll release that. She'll come up, hands still, always on the thighs. When she gets back up, she's going to do the same thing. She's going to then arch again, and then she'll breathe out. She's going to slump and feel relaxed to bend. She then bends forward, goes down, gives a little tug again, a little extension at the back muscles, and slowly coming back up. This should always be only pain-free. But what it's going to help you to do is get more comfortable with the bending motion that's involved with standing up in the most normal way possible as opposed to the guarded way possible. You want all this to be nice and relaxed. It's going to tighten a little bit, but then she comes back up. And again, it's nice and easy and really relaxed.